In December 21st, 1997, the first day of winter, a child arrived in this world approximately 12 weeks too soon. As he was expected to be March 15th of the following year, weighing in a tiny 2 pounds 10 ounces. He was immediately rushed to the section of the hospital called the neonatal ICU. He entered in a world soon to require something much more than machines and doctors could give. He would need the help of generous donors in the area, as he would need blood. During his 38-day hospital stay, he would need 4 blood transfusions from donors of blood recently in the hospital's blood bank. Nearly 21 years later, standing at 6 foot tall, 205 pounds, that tiny baby is standing in front of you today. I would not be here today without blood donors. The first section of blood transfusion began in 1818, but it would be over a century later in 1940 before the U.S. established a nationwide blood collection program. In 1970, blood banks moved towards an all volunteer donor bank, and I'm here to play a part in that today. My name is Jeremiah Nance, and I will talk to you today about the importance of giving blood. Giving blood is a very easy process. Anybody interested, parties 17 or older, can start by filling out a confidential questionnaire. Once the questionnaire is complete, you have a finger prick, and once that finger prick comes back that your blood is able to be taken and used in a positive way, you will begin the process. This process normally takes about 10 to 15 minutes. Donating blood is very important for the survival of people with all sorts of health issues, diseases, and traumas. Blood donors are especially used for mostly premature babies, cancer patients, or trauma patients. These are serious with premature babies born with a low birth rate. They're at risk for cardiovascular disease, blood disorder, which may ultimately cause a low red blood count. Transfers increase these red blood cell counts can increase iron, oxygen, and hemoglobins in their body. People with cancer often need chemotherapy. Chemotherapy does kill the bad blood cells, but it also kills your normal cells also. Blood transfusion restores these blood deficiencies. Some cancers can cause internal bleeding, and a blood transfusion is necessary. Trauma patients often need blood transfusion due to internal bleeding or loss because of severe injuries. Trauma may also be caused from accidents or self-inflictions. Oftentimes these are traumas blood donors as a matter of life and death. In conclusion, I would like to leave you with the question: do you give blood? If you do not, I would like to encourage you to do so. Blood banks need all type of blood. There are so many people in this world that need, from babies to elderly, that need your blood today. I am a living witness of that. Because someone decided to go and give blood is the reason I'm standing here today. Thank you.